Hello, my name is Caitlin Garmer, and I'll be discussing the impact of calcium and vitamin D3 supplementation on the recurrence rate of colorectal cancer following chemotherapy treatment. So, a little background information about me. I have my Bachelor's of Science degree in biology with emphasis in pre-medicine and a minor in business management that I attained from Grand Canyon University in 2016. I am currently a MSAN candidate at the University of New England with an expected graduation date of August 2020. Some of my previous volunteer experience includes volunteering for Grand Canyon University AZ HOSA. This was a Future Health Professionals Club where I volunteered as their vice president and was in charge of community service outreach and community health education. I was also a research assistant at a cancer research lab called TGen in Phoenix, Arizona. Some of my professional experience includes being a caregiver to the elderly and a medical scribe for a hand surgeon. The objectives of this research trial include to examine the impact of calcium and vitamin D supplementation on the 5-year recurrence rate of colorectal cancer following chemotherapy treatment, to assess the impact of supplementation on colorectal cancer patients under the age of 50, and to compare calcium and vitamin D3 levels between the intervention group and the control group. Some background information on colorectal cancer. Colorectal cancer is the third leading cause of cancer-related death in the United States. Research studies have shown that calcium could reduce proliferation, stimulate differentiation, and induce apoptosis or cell death. This is crucial in killing off the cancer cells. Yang's et al. Study included 2,284 participants diagnosed with invasive non-metastatic colorectal cancer were followed for 20 years. Calcium and vitamin D supplements and dietary intake of calcium were assessed in both diets of the intervention and control group. Results revealed higher intake of total calcium and milk after colorectal cancer diagnosis are associated with a lower risk of mortality. So the question arises on how calcium interacts with colorectal cancer cells to help reduce the risk. So the mechanism behind this is calcium binds to bile acids and fatty acids in the intestinal tract. This reduces the bioavailability of acids in the intestinal tract to damage the colon cells and stimulate proliferation. When damaged colon cells start reproducing, this is what would cause the colorectal cancer to form. Evidence suggests that calcium promotes E-cadherin expression and suppresses beta-catenin and T cell factor activation. And so through calcium sensing receptors and this occurs through calcium sensing receptors and will restrain the malignant behavior. Calcium is also believed to limit the growth of colorectal cancer cells, and it will also distance the metastasis from the cancer cells. So the methods for my proposed trial are a food frequency questionnaire would be used at baseline and at the end of the study to assess calcium and D3 intake. This would include assessing dairy intake along with vegetables and protein, along with sun exposure to assess D3 levels. A baseline blood draw would be used to assess calcium and D3 levels at the start of the trial. Participants would then be randomized into a control and intervention group. The intervention group would be given 2,000 milligrams per day of calcium supplements and 800 milligrams per day of vitamin D3 supplements. Previous research trials have examined various levels of calcium and D3 supplementation on colorectal cancer patients, but to my knowledge, no intervention has given this high amount of calcium and D3 supplements. So this would help assess if a higher amount would lead to an even higher reduction in recurrence rate of colorectal cancer patients. So the criteria for this study to be included: colorectal cancer survivors between the ages of 18 and 50, since the goal of our study is to assess the recurrence rate following colorectal cancer treatment. And we're also looking at patients under the age of 50. Must have undergone treatment for colorectal cancer. They must be in remission before the beginning of the trial and be capable of informed consent. Exclusions will include additional health issues, including diabetes, history of kidney stones, and additional renal issues if they're over the age of 50 and unable to provide informed consent. For this trial, there is minimal risk to the participants, but some of the risks do include the blood draw. The blood draw has minimal risk, but the risks involved include bruising, redness, and swelling. For the actual trial, there is a risk of inadequate intake. This would most likely be in obese participants, and this could lead to osteoporosis secondary to hyperparathyroidism. And there's also a risk of excessive intake, which could result in kidney stones and or kidney damage. But in this trial, the participants will be closely monitored by their primary care physicians along with their oncologists during routine checkups. The anticipated results of this study would be a post hoc analysis run on G-Power produced a sample size of 176 participants, with 88 participants in both the intervention and the control group, and this would give us a power value of 0.95. So our anticipated results would be an increased calcium and vitamin D3 intake would lower the risk of colorectal cancer recurrence in adults under the age of 50. Since the trial has not been conducted, we do not have accurate data, but the graph on the right-hand side does reveal what our anticipated data would look like. So at the baseline, calcium and vitamin D3 levels would be lower, with the rate of colorectal cancer higher. The food frequency questionnaire data would reveal an average intake of calcium with vitamin D3 levels still low and the rate of colorectal cancer still higher. And post-study data would show calcium and vitamin D3 levels have increased and the rate of colorectal cancer has decreased. So again, our anticipated results, there would be two tables. Our food frequency questionnaire results would show the average intake of dairy, fish, and vegetables along with sun exposure to assess D3. And then calcium and vitamin D levels would be assessed in a separate table, and this would include our lab values before the study, after the study, and in both the intervention and control group. So the conclusion of this research trial would reveal increased calcium and vitamin D3 levels would help reduce the risk of colorectal cancer recurrence in patients under the age of 50 within 5 years of treatment. Further studies would be necessary to help examine the difference between dietary intake of calcium and supplementation, and for future research would also be necessary to assess the official dosage of calcium and D3 levels that would be the most beneficial to patients. I'm available to answer any questions if you have any, and thank you for your time.